my experiences with HIV. I didn't really, I was born and raised in Oakland, California, and although my household was very open and liberal, and my mother had a lot of real and personal discussions with us, HIV wasn't one of them. And I think it's just because my family and community lacked information. And when I actually still in contact with a friend that I met in elementary, and in middle school her mother was diagnosed with HIV, and it just kind of opened my eyes to this particular infection and virus. And I didn't know what it was. I know that they moved away. It wasn't really talked about. I would ask questions and no one really had an answer. And so I got curious of exactly what this virus is, and what does that mean, and what does that mean for her mother, what does that mean for her children, my friends. And so I ended up doing some research on my own and just really looking into healthcare. Not necessarily healthcare, but just health information, you know. So that opened me up to looking into like sexually transmitted infections and, you know, what's happening in my community, which is again in Oakland, California. So I ended up, flash forward a few years, in high school I joined a student assistant program, and in our lunchtime club meetings we would talk about like drug use and safer sex and just the things that we were actually facing in our community violence, gang violence, religion, you know. It wasn't all bad or negative. But so there we started talking about HIV and drug use and things of that nature. And so I fast forward another few years, I ended up actually doing my senior project on HIV and the disparity of young people of color in my community, and, you know, finding out that the fastest growing population, particularly at that time for new HIV infections, were young women of color. I think the numbers have changed a little bit to be young men of color, but that was just such an eye-opening and wowing time of my life, because that was me, you know. Those were my friends that didn't know anything about HIV. Yes, we hear like put on a condom, but a lot of the prevention that we were taught was pregnancy prevention. We weren't taught about necessarily STIs or HIV or things like that. So that was really, really eye-opening for me. And I, again, through the student assistant program and through wanting to share this with others, I actually ended up being a peer educator with Hi-Fi Health Initiatives for Youth in San Francisco, and it became my passion. It's what I lived and breathed for, is to educate other young women like me and other young people to just know that, hey, this is the risk involved with some of our behaviors that people may be into, and just to know what you're putting yourself at risk for, you know. Yes, there's a positive, and, you know, there's always reasons why people are doing things, but you just have to acknowledge the risk involved, you know, and acknowledge how that may affect your life. So that's pretty much, and through the work with Hi-Fi, and through the work of health and peer education, I've been able to talk to middle school youth. I've been able to attend some middle schools, and I run my own peer education program now. And I talk to young women. I go into the juvenile justice systems, and we talk about these discussions. We sit down and we keep it real of like, okay, what are you doing? How are you putting yourself at risk? How can we be safe? And it's not necessarily it is about keeping one person safe, but it's about keeping the community safe, and it's about understanding the larger impact that various viruses and infections have on us. And so that's my HIV story. I am always the first one to go get tested with someone, go get tested myself, to you know, pass out condoms everywhere. That's always funny. You get interesting stories. I've passed them out at like sushi bars, and, you know, I've passed them out in high school. You know, men men, boys I didn't even know, you know, was like, hey, I heard that you're the health educator, you know, can you hook me up with some condoms? It's prom coming up. And I was like, okay, hey, I don't even know your name. But I would just give them like a brown paper bag full of condoms. And it's a small thing, but I felt that I was doing my part in keeping my community safe, because we have to expand it just of what's happening now and think about, well, if this doesn't stop and if people aren't educated and aware, what's going to happen in another 10 years? What's going to happen in another 50? We've done an excellent job of education, but there's still a very, very, very long road to go. And I feel that anything that I can do to help keep the community and the world safe, that is my responsibility as an inhabitant of this world, and as a community member, and as a young black woman, and, you know, just as one of the people, because we are the people that are being affected by this virus and by this infection. Thank you for listening.